This is the Disablement Model by Dylan Philwalk. A little about myself. I'm from Niles, Michigan. I am a member of the Masters of Science in Athletic Training at Ball State University, and I have played collegiate soccer at the junior college and Division I level. What is the disablement model, you may ask? Conceptual models that provide a framework for clinical practice and research, basically combining the practice aspect of athletic training along with research to give your patient the utmost rehab or exercises that they need for their injury or illness, and incorporates research into practice, patients' outlooks into care, and precise documentation, which is all very important. Patient outlooks into the care is very important because you need to understand what the illness or injury feels like, looks like on the patient, and how they're, experiencing their day-to-day lives and how it's affecting it, and precise documentation so you can record anything and everything that you've done to the patient and what you plan on doing to the patient. It is a clinical outcome assessment that serves as the framework for evidence-based practice to be applied in the athletic training field. One of the aspects of the disablement model is clinician-based outcomes. This is the patient's response to the clinician's treatment intervention. So it is basically how the injury or illness is responding to anything that the clinician does for the athlete or the patient to help them recover from their injury. Typically is determined by objective measures and impairments, and the clinician-based outcomes mostly measure impairments, and it's the clinician's job to help improve those impairments rather than overcoming them. So as a clinician, it's important that we set up a plan or an exercise that kind of helps the patient get to the overall end goal of recovering through baby steps instead of just immediately going to the last step and rushing the process. Clinician-based outcomes provides patient-centered care that considers all aspects of the injury and illness for the patient, basically using the research aspect of athletic training to combine into the clinical setting to give the patient the best care possible. Patient-based outcomes results primarily from self-report questionnaires and surveys. Patients are concerned about their health and how it affects their everyday lifestyle. Patient self-report outcomes are important because it allows the patient to explain their experiences, perceptions, and values of the illness of the injury. It is important that we understand how their experience has been dealing with the injury or illness, what their perception of pain or discomfort levels are like when they're experiencing, and the values of the illness or the injury. Patient-based outcomes are primarily divided into two subcategories: generic or specific outcome measures. And back to the patient self-reports, it's just important to get their feedback on how they are feeling. Generic self-report outcome measures often measures the HRQOL, which stands for the health-related quality of life. It is a multidimensional system and considers the well-being of the patient from the physical, functional, emotional, and social standpoint of their lives. So as clinicians, we are not only helping them treat the injury or illness from a physical standpoint, but it is also important to understand how this injury or illness is affecting their functionality, their emotional state, and their social standpoint of their lives. They are not just an athlete or a patient, but they are also, a mother or father, a son or a daughter, and they have a life to live outside of the injury and stuff to do. This blends patient-centered care with clinical patient care to cover the whole spectrum of helping the patient. So if we're dealing with a muscle tear and an injury, how it affects their range of motion, the strength and participation, we set up an exercise to help their range of motion, strength, and get them participating again. An injury that I have suffered that relates to the disablement model was MRSA or cellulitis, which is a skin infection. It was very painful, affected my day-to-day living. I couldn't play the sport I was at the school to play for a while because of this. It restricted my social communication because I had to stay at home in bed while it healed. But I was prescribed medication from the team physician, and the athletic trainer and team physician did an excellent job in checking in on me to allow me to participate again. The last part of the disablement model is the ICF, which discusses how an injury or health condition influences the participation in activities. Not only are we trying to heal an athlete as an athletic trainer to get them back on the field, but it's also we don't know if they need to go to work to help support their family or anything else they have to do in their everyday life, your body structures, and how your body functions if treated or not treated properly. Being an athletic trainer, it is important that we set up an exercise program to help their body function properly as it was before the injury or illness happened, and also how the lack of participation in activities influences their personal factors, their mental health or social well being.